Let us talk about anesthesia breathing circuit. So what is breathing circuit? It is two-way connection between patient and anesthesia machine. It brings the inspiratory gases and removes the expiratory gases. So what is a circuit? Circuit is two-way connection between anesthesia machine and patient. Two-way connection between anesthesia machine and patient. Okay, it brings the inspiratory gases from anesthesia machine towards the patient, right? The circuit brings the inspiratory gases towards patient and it removes the expiratory gases away from the patient. Okay, this is what is the work of circuit, and it has to do it very economically in the least wastage of the fresh gas from anesthesia machine, right? So we'll talk about everything, economics of the circuit, different types of circuits, etc. So types of circuit, we have open circuit grossly, we have semi-closed circuit, and we have closed circuit. Okay, now open circuit is obsolete, we need not study about it. So this is obsolete. Okay, now no longer in clinical use. Now semi-closed circuit and closed circuit, both are in clinical use and we need to study a little bit about it. So we'll study in semi-closed circuit about the Mapleson circuit, and we'll talk about the closed circuit, that is circle system. So what is Mapleson circuit or semi-closed circuit? The first point in the circuit which we need to understand, difference between semi-closed and closed circuit, how these two circuits work. So if you see this image, there are 6 circuits in the image: Mapleson A, Mapleson B, C, D, E and F. These are different types of Mapleson circuit which comes in semi-closed circuit. So how does this circuit work? Now, as I told you, circuit is a connection between patient and machine. So let us assume this is your anesthesia machine and this is your patient. Okay, this is the airway of the patient. Circuit will be connected between patient and machine. So every circuit will have a machine end. From this end, what will enter? The fresh gas would enter. Whatever new gas which enters machine into the circuit, we call it fresh gas. So fresh gas flow end, right? This is fresh gas flow end. So fresh gas would enter. So fresh gas is entering and it is going towards the patient. Okay, so the other end of the circuit would be patient's end. So this is patient's end. Now every circuit would have tubing which will bring the fresh gas towards the patient. We call it inspiratory limb. Every circuit will have a tubing which will remove the expiratory gas away from the patient into the atmosphere through a APL valve. We call it expiratory limb. Now every circuit will have a bag which is used as a reservoir bag or a bag for positive pressure ventilation, right? So the semi-closed circuit has a fixed parts. It has patient's fresh gas flow end, patient's end. It has APL valve which we will talk about. It has a rebreathing bag, right? And it has inspiratory and expiratory tubing. In semi-closed circuit, it is the same tube which is used for bringing the inspiratory gases and for removing the expiratory gases. So there is a to and fro movement of the gas. To and fro movement of gas, right? And the removal of the expiratory gases depends upon the fresh gas which enter the circuit, right? So this removal of the expiratory gases is dependent upon the fresh gas which enters the circuit, right? So this is your Mapleson circuit. Let us say how does it operate. Let us discuss how does it work. From machine end, fresh gas flow enter the circuit, right? Fresh gas enter the circuit, okay, from the machine end. Okay, now what is there in the fresh gas? Let's say it has nitrous oxide, oxygen and halothane in it, inhalational anesthetic. So this is entering the circuit. Now let us say this patient is paralyzed, cannot spontaneously breathe. Patient can breathe spontaneously if patient is not paralyzed, and patient needs positive pressure ventilation if patient is paralyzed. Let us say this patient is paralyzed. So the gas which goes towards the patient does not have effort to take this gas. So what happens? The gas gets collected in this bag also. The bag expands. When we squeeze the bag, the gas reach the patient's alveoli with a positive pressure. So nitrous oxide, oxygen, halothane, the inspiratory gas has entered the patient. Now patient is in expiratory phase. The expiratory gases enter the expiratory limb. What comprises of the expiratory gases? Expiratory gases have nitrous oxide, oxygen, halothane, whatever you are giving, plus carbon dioxide is added. So only one thing is added, that is carbon dioxide. We need to remove this carbon dioxide. Now this is the work of circuit, to give the inspiratory gases and to remove the CO2 from the expiratory gases. So in your semi-closed circuit, there is no such provision to separate this carbon dioxide from rest of the expiratory gases. So all the expiratory gases has to go out of this expiratory valve into atmosphere, right? It has to go out of this expiratory valve into atmosphere, right? And to remove this, we need to keep certain fresh gas flow, because it is the same tube in which the gas is moving to and fro, inspiratory and expiratory. If the fresh gas entering the circuit would not be of certain flow, the expiratory gas would bypass the expiratory valve and mixing will happen. And when we will squeeze the bag, patient will rebreathe carbon dioxide. To prevent this, we need to keep a certain amount of fresh gas. So as I told you, in semi-closed circuit, there is to and fro movement of the gases. We need a certain fresh gas flow to remove the expiratory gases. So to remove expiratory gases, CO2, a lot of wastage was happening. Every time we were wasting the other gases which was present in the expiratory gases, and also we had to keep a certain amount of fresh gas to remove the expiratory gases. So this circuit was doing the job of giving inspiratory gases and removing expiratory gases, but at a high cost of a lot of wastage of the gas. So economics of the circuit was really poor. So we required a new circuit with a better economics. So came circle system or closed circuit. So this is closed circuit or circle system. Now how this closed circuit or circle system works. So let me make a line diagram. Three important changes was done in the designing of the circuit. Again, a circuit is a connection between patient and machine. So again, this is patient, this is the airway, and this is the anesthesia machine. Every circuit will have a machine end. Now in closed circuit, inspiratory limb and the expiratory limb of the circuit was separated. So inspiratory limb and expiratory limb of the circuit was separated. Okay. Unidirectional valves was attached. Okay. So now let's see how the gas moves. From machine, the fresh gas enter, the inspiratory gas enter. It enters through this one-way valve only in the inspiratory limb. Only in the inspiratory limb. So what are the gases? Nitrous oxide, oxygen, and your isoflurane. So this enters the patient. Now patient expire. Expiratory gases enter the expiratory limb through this one-way valve. So what is the expiratory gases? Nitrous oxide, oxygen, iso, and carbon dioxide. In expiratory limb, a very important new component was added, that is called carbon dioxide absorber. This has small granules present in it, made up of some chemical substance. When the expiratory gas passes through it, this chemical present in these granules react with carbon dioxide, and carbon dioxide is absorbed, and rest of the expiratory gases are recycled into the inspiratory limb. So this is circle system. The gas is not moving to and fro. It is moving in a circle, and we are not dependent on the fresh gas flow for removal of carbon dioxide. CO2 is removed by a chemical reaction. So requirement of fresh gas flow is very minimal. So this circuit became very economical over the semi-closed circuit. So let us first discuss the difference between closed and circle system and the Mapleson circuit. So difference between Mapleson circuit and circle system. Circle system. So just now as we discussed that circle system is more economical, requires a less fresh gas flow for CO2 removal. So circle system is more economical circuit, right? Less wastage of gas. Mapleson circuit is less economical. So Mapleson circuit is less economical. Okay. So we need in economics of circuit, better is circle system. The second advantage of circle system over Mapleson circuit. If you see here, CO2 is getting absorbed by a chemical reaction, rest of the gases are recycled. Here, all the expiratory gases are going into atmosphere. So OT pollution, atmospheric pollution, even with scavenging system, is very high in the Mapleson circuit. So more operating room pollution, the atmospheric pollution, operating room, atmospheric pollution, right? Here, minimal pollution. This is minimal operating room pollution. Okay. Now, another benefit of circle system over the Mapleson circuit. Here, all the expiratory gases going into atmosphere. So we know inspiratory gases are non-humidified gases, and when it passes through the respiratory tract of the patient, the expiratory gas, they get humidified. Expiratory gas which comes out, they are humidified. So when there is a loss of expiratory gas, there is a loss of heat and humidification also. So in Mapleson circuit, we are talking about Mapleson and the circle system, right? In Mapleson circuit, there is loss of heat and humidification. Loss of heat and humidification. In closed circuit, there is recycling of heat and humidification. Recycling of heat and humidification. Okay. So remember guys, circle system is best. The best circuit is circle system. Today in our operating room, for any type of ventilation, in any age group of patient, we are using circle system. Then why is Mapleson circuit still not obsolete like open circuit? What is the benefit of Mapleson circuit? Well, if you see the circle system, now it has CO2 absorber attached to it. And CO2 absorber attached to it is this CO2 absorber is attached to your anesthesia machine. This is attached to anesthesia machine. So your circle system can only work with anesthesia machine. It cannot work independent of machine. But your Mapleson circuit, this is lightweight, simple circuit which can be used for, let's say, places where the anesthesia machine is not kept also with a cylinder, with the help of a cylinder. The portability and simplicity has retained the work of Mapleson circuit. So remember that the benefit of Mapleson over the circle system. Mapleson circuit is lightweight, simple circuit which can be taken from one place to another. It's portable, right? So if I have to give distant place anesthesia, we can use Mapleson circuit. So now let us see the advantage of Mapleson circuit over the circle system. See, circle system can only be used along with anesthesia machine. The reason that CO2 absorber which is attached to it can only be used along with anesthesia machine. So it cannot be used independent of machine. So if I have to take a patient on circuit from one place to another, if I don't have an option and only circle system, I'll have to move the entire anesthesia machine along with the patient, which is very cumbersome. So we need a portable system, and Mapleson system is still in clinical use because of its portability. It is lightweight, simple circuit which can be taken from one place to another. It can be used for giving distant place anesthesia. its portability has retained its use. Okay, so Mapleson circuit is lightweight, simple circuit, portable, right? Your circle system is complex, bulky, and fixed circuit. Now, apart from this, another benefit of Mapleson circuit. In Mapleson circuit, the expiratory gases are moving out of the APL valve completely, and every time the fresh inspiratory gases are going to the patient. So you know exactly what is the gas patient is inspiring and what is the constituent of that gas. But in circle system, the gases are getting recycled. So in the gases which is passing through CO2 absorber, we have nitrous oxide, oxygen, inhalational anesthetic. If some of these gases react with the chemical substance present in CO2 absorber and form some toxic metabolite, that will also get recycled and reach the alveoli of the patient. So in circle system, we need to have some monitoring to see the proper oxygenation of the patient is maintained or not, right? There was a very old inhalational agent called trialine. Now, trialine, when used with CO2 absorber, it used to react with CO2 absorber and form phosgene. This phosgene used to go into the alveoli of the patient and cause cranial nerve palsies. Now, trialine is not in clinical use, okay, but there are still some inhalational anesthetics like your desflurane, your isoflurane, which can react with CO2 absorber and form some toxic byproduct like carbon monoxide, and which can reach the patient in certain condition. So we need some advanced monitoring in circle system, which is not required in Mapleson circuit. The reason being, every time fresh inspiratory gas going to the patient, all expiratory into atmosphere. So the circle system needs advanced monitoring. Advanced monitoring. Now, Mapleson circuit also, if we have monitoring, we'll attach it. But if it is not there, it is safer to use Mapleson circuit. So, advanced monitoring, not mandatory. Monitoring, not mandatory. Okay. So, remember this. Because of these two reasons, still Mapleson circuit are in clinical use. Well, we need advanced monitoring. We have it. Circle system is best, undoubtedly. So no doubt, circle system is the best circuit today, what we have. Okay. Mapleson is still used at certain condition where it is required to be used because of its portability. Otherwise, we use circle system. Okay. Now we will discuss different types of Mapleson circuit. Maximum questions on the circuit is asked on the Mapleson circuit. So we will just discuss different Mapleson circuits. So as we discussed Mapleson circuit, it's a two-flow system in which the gas flow in to and fro movement, and CO2 removal is dependent on the fresh gas flow coming from the circuit. Now let us first discuss what are the parts of Mapleson circuit. So as I told you, Mapleson circuit is to and fro system in which CO2 removal is dependent on fresh gas flow. So remember this, okay? It's a to and fro system and CO2 removal is dependent on fresh gas flow. What are the parts of Mapleson circuit? It has fresh gas flow end, that is the machine end. It has inspiratory and expiratory limb, right? We call it the tubings of the circuit. Then it has adjustable pressure limiting valve, adjustable pressure limiting valve, adjustable pressure limiting valve, and it has the rebreathing bag, and it has patient end. Now all the Mapleson circuit, there are 6 Mapleson circuit, A, B, C, D, E, F. All the Mapleson circuit will have the same parts. Only arrangement of one part from another is changed and different circuit comes into existence. So if I show you, we have total 6 Mapleson circuit, A, B, C, D, E and F, right? And all of them have the same paths. So if I show you fresh gas flow inlet, right? Mapleson A has it. Then APL valve, it has it. Inspiratory and expiratory limb, yes. Rebreathing bag, yes. And patient end, yes. So it has all the paths, okay? Similarly, Mapleson D also has fresh gas inlet, patient end, tubings for the inspiratory expiratory gas movement, APL valve, and the rebreathing bag. So all the circuit have the same paths, only orientation of one part from another is changed and different circuit comes into existence. So how is Mapleson circuit designed? If you see, when the patient end, this is the patient end, the APL valve is near the patient end, this part of the tubing forms the expiratory limb. The expiratory limb is shorter, the inspiratory limb is longer. If you see Mapleson D, this is the fresh gas inlet near the patient end. So the inspiratory limb is shorter and the expiratory limb is longer. Okay. So Mapleson D, inspiratory limb is shorter, expiratory limb is longer. Mapleson A, just vice versa. Mapleson A has shorter expiratory limb. It is good for spontaneous ventilation. Mapleson D has shorter inspiratory limb. It is good for controlled ventilation. Now, how is this good decided? In a moment, I will tell you. Okay. So, as I told you, parts are same. Only orientation of one part from another is changed and different circuit comes into existence. When the fresh gas inlet is away from the patient, it is Mapleson A. When fresh gas inlet is near the patient, it is Mapleson D. Okay. So, let us see how the circuit, like what are the things which we need to discuss about the circuit. Now, about all the Mapleson circuit, we need to discuss few very important things. We need to compare the Mapleson circuit on following points. Number one, we need to know that they are good for adult or pediatrics. So, which are adult circuit and which are pediatric circuit. So, first thing we have to know this, and why some circuit can only be used in adult and why not in pediatrics. Okay. So let us discuss this first point. So what is the problem in pediatric patients? The pediatric patient cannot withstand high pressure and high resistance. So they cannot tolerate high pressure and high resistance. Okay. So what is causing high pressure and high resistance? Let me make the design of Mapleson A circuit. So let's say this is Mapleson A. Okay, this is Mapleson A circuit. Okay, this is Mapleson A. Okay, now this is machine end, this is patient end. From machine end, the fresh gas go towards the patient, right? When the gas goes into this bag, the bag expand. I squeeze the bag, the gas reach with a positive pressure to the patient. So this bag is causing high pressure generation. So this bag is causing pressure. And when the patient expire, the expiratory gases has to go out through this valve. And this valve is offering resistance. So this high resistance and high pressure is because of this valve and this bag. So I remove both in pediatric. And a very simple circuit was designed for pediatric patient. If you see this is Mapleson E circuit. Neither the bag is there nor the APL valve is there. Okay. So this is let's say just a T-shape, inverted T-shape circuit. This was fresh gas flow inlet. This is my patient end and this end is open to atmosphere. Okay. This circuit has no bag, no valve. So there was nothing to offer any resistance or any, let's say, pressure. So this was the first pediatric circuit, E. And E was not very beneficial. I will talk about it. It was modified in the form of F. So F circuit also does not have any APL valve as E. Only a bag has been attached. This bag is open to atmosphere. This is not a closed bag like D or A. It is a bag open to atmosphere. So F. E and F is pediatric. So remember, Mapleson A, B, C, D. These are adult circuit. E and F is pediatric. Okay, ENF is pediatric. Now, another thing which we need to know about the circuit, the second point which we need to know is, does circuit has any synonym? Now, a lot of circuit has other names, like Mapleson A is also called Magel circuit. So we have to know about that. Then we need to know for what type of ventilation the circuit is good for spontaneous or for controlled ventilation, and how it is decided and why. And then we need to know what is the fresh gas flow we need to keep in the circuit for the removal of CO2, removal of carbon dioxide from the circuit. I told you, Mapleson circuit depends upon the fresh gas flow for CO2 removal. So what fresh gas flow we have to keep to remove the carbon dioxide. So these are the 4 important points we have to compare the circuits on. The first point we have already discussed, that A, B, C, D is adult, ENF is pediatric. I will divide my discussion. First I will discuss adult circuit, then I will discuss the pediatric circuit.